Hey everyone, this is Dr. Ravi Somayazula, board certified plastic surgeon in Houston, Texas, and today we're talking about breast aesthetics and breast surgery. When patients come to me, typically they come to me for a variety of reasons. The most common reasons are a lot of women in my practice are women who've had children, they've breastfed, they have a little bit of postpartum volume deflation and breastosis. What that means is their breasts are saggy, they've lost a little bit of volume, and for a lot of women, it's just lack of upper pole fullness. So if you look at yourself from the side, you may notice you're flat at the top, and most of the breast is hanging below, and actually sometimes the breast is actually touching the upper part of the abdomen. And so really it depends on the situation. There's no specific procedure that's one size fits all. And that's the one thing that's very important to understand, is that really this is literally a bespoke approach to literally every single patient who comes into my practice. I have different conversations with different people all the time. And it's, we did the same procedure on 2 different people because we never do that. Really, it's about sitting down and listening to what bothers you. And I think that's extremely important. I think we do a great job of really listening, because when you come into the office, we want to know what bothers you, and then we try to find a solution or a treatment plan that's specifically suited specifically to you. There are different tools in my toolbox that I can use in aesthetic breast surgery. Fat is one of them, implants are another, and then different scar techniques for lifts can be combined with the use of fat or implants to rejuvenate the breast. You can also use internal support. A lot of people know that as the internal bra. There are whole combinations of things that I can use to create a specific result based on what bothers someone. As you guys know, we use breast implants all the time. They're very safe, they're very effective in cosmetic aesthetic breast surgery, and there's different manufacturers out there. Without getting into too much detail, because there's probably another video for this, is a great way to volumize the breast. It can add size, it can add upper pole fullness. That can be combined with a little bit of fat grafting to improve cleavage, or if somebody doesn't want an implant, fat can be used as a sole method of adding volume. However, there are limitations to just using fat without an implant that patients need to know. Photos are a great way to, in these cases, get an idea of what your goals are. So sometimes in the consultation, we may review photos to get an idea of this patient's specific goals and desires. And if I feel as though their starting point in the photos that they're showing me show me that they're interested in some size increase, we may not be able to achieve that with fat. So try to have an open mind when you go in to see your plastic surgeon, because you can still get a great result, and there may be a different tool in the toolbox that the surgeon would have to use to get that result, and it may not be with maybe fat grafting alone, maybe combined with fat grafting and an implant. So really, there are different options. There isn't a cookie cutter approach to this, but fat can be used by itself, fat can be used with an implant, and then also fat can be used with a lift with an implant. So I can perform a mastopexy or breast lift and use an implant and do a little bit of fat grafting, or I can do a mastopexy with just fat grafting and without an implant. These are all the different options out there, but it may not be the right option for you, because your goals and desires may be different than the next person who's trying to achieve something else. As far as that internal bra is concerned, that internal bra is a great way to help support the breast tissue, whether that's used in conjunction with an implant or used in conjunction with just a mastopexy. It is a great tool in my toolbox to help support that lower pole to create a really nice shape over a longer period of time. So I've been using a lot more soft tissue support in my practice, and it's significantly revolutionized my long-term shape with patients, specifically in aesthetic breast surgery.